Hey everybody, John Schumacher here with NewWaveHealthcare.com, where digital health companies come to share their story. Today I have Dr. Javeed Siddiqui, who is the founder of Telemed to You, a company that's devoted to bringing its clients real-time access to physician specialists through the use of telemedicine. And today Dr. Siddiqui has been kind enough to come on the show today. Tell us a little bit about himself personally, talk about telemedicine and his company, Telemed to You. So, Dr. Siddiqui, thank you so much for coming on today and talking about those things. Let's go ahead and have you just start off. Just tell us a little bit about you personally, your personal background, and then we'll jump into your business.
Sure, absolutely. Thanks so much for having me, John. It's a real privilege and an honor to be here. So as you introduced me, my name is Javeed Siddiqui. I'm the co-founder of Telemed to You. So personally, I'm an adult infectious diseases physician. I've been practicing infectious disease medicine for quite a few years now. And I spent the first part of my career, over 10 years, as a faculty member at the University of California, Davis. And there I got my start in telemedicine back in 2002. And had a tremendous mentor in Dr. Tom Nesbitt. Dr. Nesbitt is really the father of telemedicine across the state of California, and it's hard to find anyone who's in telemedicine who hasn't been touched by Dr. Nesbitt. So I worked there for quite a few years and was privileged enough to be the medical director there over at the Center for Health and Technology. And then for very personal reasons, 4 years ago, left and started Telemed to You. And so we've been in business since 2011.
Perfect. Yeah, so you have an extensive medical background around the telemedicine arena. Is that correct?
Yeah, I've been in telemedicine. So like I said, I've been actively practicing telemedicine since 2002, and really started it because as an infectious disease physician, there's not a whole lot of us subspecialists across the United States. There's less than about 11,000 of us, and one of the things that I do and my real passion in life and why I went into medicine was to practice HIV medicine. So I would have HIV patients who would drive 3-4 hours one way just to see me. I kept on thinking, I'm not that good. I don't need anyone to be wasting 8 hours in a day to come see me for a 15-minute appointment, and especially for the most time for me to tell them they're doing great. So, telemedicine is providing healthcare over a distance using real-time audio-video technologies. And so what I started to do in 2002 was be able to provide that type of care, and we've been providing that type of care ever since. And it's really nice because people can stay in their communities. They don't have to take a full day off of work. They don't have to spend the time, money, and expense in order to drive somewhere just to see a physician for 15 minutes.
Right. Exactly. Yep. It's a wonderful, wonderful thing you guys are doing, and I hope it seems to continue to grow in importance. And telemedicine is definitely emerging as a viable solution for a lot of problems in rural communities and everything. So I think that's really neat. So hit us with your elevator pitch, man. Like, tell us, if someone came up to you in an elevator and say, "What do you do?" Hit us with that.
Absolutely. So at Telemed to You, we're 100% telemedicine-based multi-specialty clinical practice. We increase access to care. That's all we do. We help bring patients and doctors together.
Beautiful. Yeah, boom, right there, right? You got it nailed. So
I've maybe said that once or twice.
You've probably gone through that a couple times, right? So paint a picture then, kind of paint the image of the key problems you guys are out to solve at Telemed to You. Just paint a picture for us.
Sure, absolutely. Well, how we engage healthcare really hasn't changed for generations, right? I mean, I refer to it as the healthcare industrial complex. I mean, they still require us to leave our work, to leave what we're doing, working in very, very important, wonderful startups, get in our cars, sit in traffic, drive to a building, find parking, sit in a waiting room with a bunch of other sick people to see a doctor who sees you for 15 minutes and you kind of leave feeling somewhat unsatisfied. I mean, that's healthcare these days in the United States, and it really hasn't changed for generations. And there's no reason why it should be. I mean, healthcare outside of diagnostics has been incredibly recalcitrant to technologies. I mean, yes, when it comes to 3 Tesla MRIs or using PCR machines, we're great in healthcare. But when it comes to workflow management, when it comes to really changing how we interact in healthcare, the healthcare industrial complex has been incredibly recalcitrant to doing that. And so what we're trying to do is really change that. What we want to do is change the way people interact with healthcare. We want to increase access to care, and we want to decrease the per capita cost of care. right? And we feel that telemedicine is a very important tool in doing that, and we're actively doing that in multiple arenas right now.
Right. So what inspired you to do this? I think you touched on it in the beginning of the interview here, but what inspired you to start in telemedicine and take on this problem?
Well, we started Telemed to you because we really believed that telemedicine was ready for prime time. I mean, obviously, telemedicine started at NASA, and then it went to the military. The military is a huge user of telemedicine. And then for 10 years, it really was incubated in academic medical centers. And they did a phenomenal job incubating telemedicine. But I really felt telemedicine had gone from that bleeding edge technology into cutting edge technology. And we felt there was a tremendous market for it. And we felt that patients and individuals, I should say, would gain tremendously by having access to it. You know, it's been my life's work. It's been something that I've really wanted to pursue, and I felt that, you know, if I didn't do this startup, if I didn't try to increase access to care through telemedicine, I would really regret that my entire life. So that's why we started this company.
So list off a couple of like specialties. You guys are networking with hospitals and skilled nursing facilities, et cetera, within California, right? You're in a California network.
Yes.
So list off some of the solutions, I guess, you guys are providing within different niches in medicine.
Absolutely. Well, you know, the entire continuum of care, I think, fits well into telemedicine. So think about this, right? Let's say you have a rash, right? And not quite sure what the rash is, and you put some creams on it for a couple of days, or if you're a guy, you just ignored it, right? Didn't do anything with it for about a month, and then it started getting worse, and okay, finally got guilty, right? And so if you go to your urgent care, well, the urgent care will look at it and go, gosh, you know, I think you need to see a dermatologist. Well, what do you do now? You really don't have any way. They either say, go back to your primary care doctor, or, you know, kind of get online, find a dermatologist. You call a dermatologist, they go, well, you need your primary care referral. It's just a very frustrating concept. So what we say is, you go to your urgent care. They need a dermatology consult, they call Telemed to you and they say, hey, listen, you know what? We can get you in touch with a dermatologist. Matter of fact, you can see one in a couple of days. Just come on back to this office and we'll see one. I mean, most people don't realize it's incredibly difficult to see specialty physicians across the United States. Matter of fact, the American Medical Association did a survey of the top urban centers, and the average time from putting in a request to see a specialist to seeing one was 60 days or longer. 60 days or longer. I mean, that's just, you know, where we are in healthcare in the United States, that's just not acceptable. And I think that with telemedicine, we're able to get patients into seeing subspecialists a lot quicker. Most of our patients can get in within a week, sometimes even within the same week, to see their subspecialist. So again, it doesn't matter whether you're in a hospital, whether you're in urgent care, whether you're in skilled nursing care, in rehab, no matter where you are in the entire healthcare spectrum, we believe that telemedicine has a role, and the whole idea of telemedicine is to increase access to care.
Sure. Yeah. So talk about the market of telemedicine then. I mean, how large is it? What are some of the growth metrics for that industry? Can you touch on those things?
Sure, absolutely. I mean, several people have said that telemedicine by itself in the United States, you know, is easily, you know, a $10 billion a year market. Other people have said it's a lot higher. Worldwide, some people have put estimates over $100 billion as far as the telemedicine market. But really, it's wherever healthcare is being delivered. I think that right now, telemedicine is still cutting edge. It still is leading. It's not bleeding edge technology, it is cutting edge technology, but I think it's really needs to become standard of care technology, and I think we're getting there. Because, you know, the generation, not my generation because I'm old, but your generation, you know, is used to doing this, right? I mean, is very familiar with video conferencing, with Skype, with FaceTime, and you use online platforms to do everything in life. You manage your money. I mean, you find your significant other to managing your money online. So why can't you get healthcare online? And I think that's really it's going to take a huge change from the consumer, because I think the healthcare industrial complex, they're doing fine. They're making a lot. You know, the traditional stalwarts of healthcare are making a tremendous amount of money without necessarily being forced to change. Now, healthcare reform, as we think about it, is going to move that along a little bit, but I really think the power of telemedicine is going to come from the consumer. When the consumer says, listen, I'm not happy with the way I'm getting healthcare delivery and I want telemedicine, and starts demanding it, that's when the big healthcare systems will change. Until then, I don't think they really have much incentive to change.
Right. Yeah, it has to come from the consumer, right? Enough people have to demand it and want it as a standard of care before they really will move forward with that, right? I mean, but as far as awareness, like, what do you think is the biggest barrier for that? Because it's almost like a lot of people I'll mention telemedicine to, they haven't even heard of it, or is that the big barrier? Is just awareness and education?
Well, I think you're absolutely right. I think awareness and education is one, but I also think there's a great deal of misinformation about telemedicine, because there's people out there who just deal with telephone calls and with emails and call themselves telemedicine. That's not telemedicine. Telemedicine is real-time audio-video consultation, right? It's just like we're interacting right now. It's me as a physician being able to connect with a patient, right? And I really feel that I'm able to have just as much, if not more, connection with that patient through telemedicine than I am in a traditional bricks and mortar environment. So I think it's going to take a combination of a lot more education, a lot more awareness, but also people realizing that we have to change in healthcare. I mean, the healthcare industry, the way it is right now, isn't sustainable. We have to change.
Right. Right. Yep. Absolutely. So, and hopefully it's getting there. It seems to be. Are you seeing growth within the telemedicine field? I mean, are the numbers growing, or is it plateauing? Where is that at?
No, it's increasing, almost at an exponential rate. But then again, they're small numbers, but we're definitely gaining market share throughout the entire United States, because I think people are realizing that, one, it's a much more effective way of delivering healthcare, and the overhead is a lot less, and consumers are requesting it. So it's increasing quite dramatically. You see tremendous examples, like the Veterans Administration is doing a phenomenal job using telemedicine for psychiatric help for our Gulf War veterans. I think it's just been an incredible tool for them. You see many rural areas that are now using telemedicine more and more. And in California, we're tremendously lucky, because we have something called the California Telehealth Network, which again was one of the ideas and a project, really a brainchild of Dr. Tom Nesbitt, and now we see it in fruition with the California Telehealth Network, which is an organization that throughout the United States is not only providing broadband connectivity to healthcare centers, whether you be a small rural healthcare center or you be an urban large medical center, but also not only providing equipment to them, but also helping them provide services. So we have a tremendous beginning of laying that infrastructure in California to really start using telemedicine at a much more significant scale.
Right. Yep. Yeah, it's great. It's coming. So let's get back to your company now, Telemed, to you, and talk about that a little bit. So how would you, let's say somebody who's interested, who's an entrepreneur in the digital health industry, or somebody who's interested in telemedicine, wants to start a telemedicine company. Like, let's say, let's just use physical therapy, since I'm a physical therapist. Maybe I could extract some knowledge from you here. Let's say I wanted to go out and start a telemedicine service.
Mm-hmm.
How do you go about, let's just start with funding. Like, how do you get seed funding for that? Or tell us about your company and what you did initially to start that ball rolling.
Absolutely. Well, I made one classic mistake when I was thinking about starting Telemed to you. And I talked to people who had been incredibly successful. That's important, but I left out one very, very important part of the equation. I didn't talk to people who had failed. And going back, I would have to say that was one of my biggest mistakes. I didn't specifically seek out people who tried to do this and weren't able to do this, and ask them what happened, what were not necessarily mistakes, but what are the issues that led to your demise. Because unfortunately, the landscape is just littered with companies that have tried to be in telemedicine and haven't succeeded. When you're trying to do telemedicine, there's two very different types of companies. One is a technology company, someone who writes codes or sell boxes, and those are incredibly important. And then the much, much smaller portion of the telemedicine environment, or landscape, are individuals who provide services. I would say it's probably 90-10. 90% of the people who are in telemedicine right now write code and make boxes and make platforms. And like I said, they're incredibly important, because without them, I wouldn't be able to do what I do, or we wouldn't be able to do what we do in our company. But the services delivery aspect of it, it's a very low margin field. It's a lot of hard work, and it's turning, it's turning an aircraft carrier, trying to get an industry to accept doing this. And healthcare isn't people think about healthcare being a very cutting edge arena, but it's not. I mean, diagnostics it is, but every other aspect of technology, healthcare is incredibly archaic. So it's very difficult. So trying to get funders is not only is it essential, but it's difficult because unfortunately you're offering them a very low margin business, and it takes people who are very experienced in funding healthcare to look at your business, because most people will say, these kinds of margins, are you kidding me? I would much rather try to come up with an application. I'd rather come up with a device or something that I can that the upside is much bigger on. The upside in healthcare, unfortunately, is not that great unless you have just huge amounts of volume or you're a massive healthcare system. So it's very difficult.
So why are the margins so low for telehealth companies?
Well, the margins are very low because if you're delivering services like we are, because the compensation for services is rather low. Unfortunately, we're the last stop on the food chain. The large medical centers get their cut. Everyone gets their cut, and then the providers are among the last. I mean, as a physical therapist, you know what's happening with reimbursement. I mean, it's really interesting. We work in an industry where we can tell people what we charge, but the insurance company can go, nah, don't like that number. I'm going to pay you maybe 20% of that number, and you really have no other recourse except to say, thank you, sir. You really don't have anything else to do except accept that payment. So it's very difficult. It's very challenging.
Right. Are you seeing any cash-based services surfacing around telemedicine?
There's a tremendous number, and it seems like every day there's a new company that's launching that's a direct-to-consumer company. They've had marginal success, and I think part of it is that I think some people have had some very negative experiences with it. I can't speak for anyone else, but one thing, as someone who's been in the space for a long time, you can really tell whether the company's really based in quality of care. And I think that's really the market differentiator. And I think that's what the consumer really wants. They really want an experience that they feel is not only equal to a bricks and mortar, but really even better than a bricks and mortar. And sometimes when they just get a telephone call or just get an email, once again, they feel like they've gotten I'd say a cheap interaction with healthcare. That wasn't worth whatever money I spent. And healthcare really giving people a positive experience. Healthcare really hasn't concentrated on that a whole lot, because they're like, we're here when you need us, and we're going to deliver the kind of care that we give you. So it's taking a huge change in the overall concept of healthcare delivery. There's not a whole lot of people doing that. I think some people are, and there's some people doing that to a degree of success, and kudos to them for reaching that success. But there's a lot of people trying to do that direct to consumer. I think more importantly, the reason why there's not a whole lot of other people in our space is because we're in the trenches doing the dirty work, doing the hard work, doing the low margin work, trying to build that solid platform, that solid base that we can then use to build other healthcare concepts and other healthcare streams on that'll help us be a successful company.
Right. So if it is a low margin business, can you tell us, how much you guys are doing, annually in revenue now?
Sure. I mean, we started off with zero. When we opened our doors in 2011, honestly, that's how scary it was. We had absolutely no clients whatsoever. We had no contracts. We had no patients. And what we really did, we spent a tremendous amount of time just building our infrastructure, because what we believed, and I still believe today, that our secret sauce is our workflow management. one of the biggest mistakes people make in telemedicine is that they believe that it's about putting someone in front of a computer or in front of a box, and once you put a doctor in front of a box, everything else takes care of itself. Well, you know, if you work with physicians, you know, one, they don't like to do anything new. Most of them don't communicate very well, and they love wearing stripes and plaids, which just messes up the entire video image to begin with. So it's there's a tremendous learning curve that has to occur. You have to teach individuals to how to do telemedicine, and we spend a lot of time recruiting physicians. Matter of fact, we only accept about less than 3, about 2.4 of every 10 physicians that we interview actually join our company and actually become telemedicine providers for a myriad of reasons, but majority because they just can't communicate well on the platform. So it really takes someone who has excellent communication skills to be able to make that connection with the patient in the platform.
Right.
So, we spent a lot of time doing that, but now, you know, it's been 3 years into business. We're just about, you know, we're a little shy of $1 million in revenue in 2013, but we hope we're going to cross that marker in 2014 and continuing to build.
Sounds good. So what was the biggest challenge for you guys starting? I mean, can you talk about the early challenges, take us back to that ground level there and share that with us?
Well, our early challenges, the challenges we still have right now, obviously, you know, it's definitely a chicken or the egg. You know, one is, do you have more physicians and spend time recruiting physicians and having physicians in your practice, or do you go out there and try to find contracts? And I think you have to do both together, and it's a little bit of building. But trying to get traditional healthcare to accept telemedicine, that's a tough thing, and I think that's one of our biggest challenges. One, healthcare administrators, you know, they really don't want to hear from a doctor that things are going to go, that this is a new way of delivering healthcare, this is all great and all that. They don't want to hear that from a doctor. They want to hear that from one of their own colleagues. And I think that's why it's important that my business partner is an MBA with a tremendous amount of experience in healthcare, and our entire team is business finance people with tremendous amount of healthcare experience who can go out there and try to sell to those accounts. But that's probably our biggest challenge, is trying to get the industrial healthcare complex to believe there's a new way of doing business, because they've just been doing business the same old way for such a long time and profiting very, very well that, you know, there's a little bit of I really don't need, there's nothing broke, so why should we fix it?
Right.
And then our other challenge is when people come in, you know, when other healthcare systems come in and see what we're doing, the first thing they go is, that's easy. I can do that myself. I don't need these guys. These guys aren't doing anything. They don't have no secret sauce. I can go out there and do it myself. And you see so many healthcare systems trying to do it, and they spend, you know, a tremendous amount of time, effort, and money rather than, you know, to reinvent the wheel rather than utilizing an organization like us.
Right. Yep. So what? Speaking of your company now, so I'm sure there's other services on the marketplace. Can you speak a little bit about your competition and what makes your company different than your competitors?
Sure. You know, we, like everyone, we have competitors, and I think our competitors are either the academic medical centers or in the private sector. We have competitors, but you see a tremendous amount of segmentation of the market. People who just want to do inpatient care, or just want to do outpatient care, or just want to do direct-to-consumer. And I think one thing that makes us all makes Telemed to you very different is that we have a role in all the segments and the entire spectrum, because we really do believe in increasing access to care and the continuity of care. And we believe that we can really serve urgent cares, hospitals, clinics, skilled nursing care, rehab, that we can serve the entire continuum. There's very few people willing to take that on. I think part of the reason we took it on is because my life's work has been telemedicine. I mean, there's very few people, you know, there's very few of our competitors out there that are headed by someone who telemedicine's been their life work, right? I mean, they've gotten into telemedicine, they've learned about telemedicine, they're enthusiastic looking at some of what they believe is the financial gain from telemedicine, but few people have really spent nearly their entire careers in telemedicine working it and seeing the evolution of it. And I think that's what makes us very different, is because we have that history and we have that operational know-how, and more importantly, we see a role throughout the entire continuum rather than segmenting the marketplace.
Right. So speaking of that vision, then, what is your guys' vision for the future for Telemed to you?
Well, our vision is to continue to grow and continue to work throughout the spectrum. We're working in, like I said, in all those different phases, but we'd like to continue to grow those phases and continue to add new specialties. I mean, we'd like to do innovative things. Like, one of the things that we're doing is outpatient infusion using telemedicine. Another thing is we really want to continue to build our breast health program, because we believe that breast health is incredibly important, and very, very few people outside of academic medical centers have even wanted to look at telemedicine for breast health. And I think that's incredibly important. And being able to connect with patients more often, I think consumers are going to demand that. They're going to be like, listen, I've got different devices that allow me to connect with my entire family, my business people, my finances. Why can't I connect to healthcare this way?
Right, sure. So what's your guys' strategy then for obtaining that kind of growth?
Well, I think this year we're really hoping to enhance our marketing, our sales and marketing force, because I think that's tremendously important to us. We really have to increase our sales and marketing, and we're really going to be putting a lot of resources towards that, because I think we need to get the word out a little bit more. At 3 years of experience in the space, we've built a significant base. We're seeing a significant number of patients every month. So now it's time to really grow. And I think, and it's not any one segment. We want to grow the urgent care, the clinic base, the hospital base, the skilled nursing care, the rehab. We want to grow the entire spectrum of that. And we need to bring on more doctors in order to serve that. So we're going to be working really hard to expand our entire portfolio of business.
Right. So what metrics are you guys using to measure all that?
Well, we use a huge, coming from academics, I'm a huge believer in metrics, and I think that we look at everything from the time that someone requests a consult to the time that patient is scheduled to the time that patient is seen. Right? We want to keep, we'd love to keep that in single digits. Right? So someone requests a consult on Monday, we want to make sure that before we ever get to Wednesday or Thursday, that consult is scheduled, and within a single digit, that patient is seen and that healthcare is delivered. So we look at those metrics. Then obviously we look at our quality metrics. We have a staff and myself that reviews the quality of care that our physicians are providing. We're always overseeing our physicians. We're always overseeing the notes that our physicians write, because again, at the end of the day, that consultation note, that's our final product. That's what goes to the consumer. That's what goes to the hospital or to the patient. So we're reviewing that, making sure the quality of that is up to speed. And then finally, we have financial metrics as well. Are we able to compensate our physicians on a appropriate basis? And I think one of the things is we're a very low overhead revenue stream for our physicians, because outside of paying for their internet access, their medical license, and their medical malpractice, they don't have to pay for anything else if they work with us, because we take care of everything else. We're a very low overhead revenue stream for our doctors. And then obviously we want to make sure that we're able to continue to grow the company.
Right. So briefly touch on your guys' business model. Like, how are you guys generating revenue?
We're generating revenue by seeing a lot of patients. This is a volume business. There's no there's no secret business model to all of this. This is healthcare delivery, and in healthcare, you have to, you have a small margin and you have to have volume. And so what we want to do, we want to differentiate ourselves through quality. Absolutely, that's our main differentiator. Yes, we can talk about the fact we're technology agnostic. Our physicians can use, whether it be PC, OS, Android platform, it doesn't matter. The telemedicine platform that we've chosen is technology agnostic. It doesn't matter if they use a laptop, a tablet device, or a desktop. But for us, more than anything else, it's the quality. Right? We want to make sure that our physicians are able to deliver the quality of care that we promise our consumers. And secondly, we want to make sure our consumers are happy. So those are really differentiators for us, and we feel, and what we've seen that we've been able to differentiate ourselves from our competitors in California, specifically based on our quality. We've had customers who've said, "I've been with X, Y, and Z. I see the level of support and level of quality that Telemed to you provides. So we want to do business with you." So it's been really positive this last year. We've probably had almost 10 new clients come on specifically saying that we're changing from one of our competitors to us. We didn't seek them out. We didn't challenge them. We didn't do anything. They approached us and said, "We've heard of the quality of care that you provide and the quality of service that you deliver, and that's what we want and our patients want."
Sure. Everyone wants quality, so that's it. So, all right. So here's our last question for the interview, and it's a doozy. So here we go. Let's say you woke up tomorrow and the Affordable Care Act offered new legislation for your company. How would you want it to read?
Absolutely. Well, the Patient Protection and Affordable Care Act is incredibly telemedicine friendly. So the way it's written right now, I'm perfectly fine with it. I don't need it to change, except for reimbursing telemedicine at 150% as it reimburses bricks and mortar. That would be fabulous.
Sure. Okay.
But really, healthcare reform, and in the interest of full disclosure, I had the tremendous opportunity of being a subject matter expert during the whole, to several of the senators during the healthcare reform debate during my time at the University of California and the University of California, Davis specifically. And so I was able to educate them on the value of telemedicine. Also, Dr. Nesbitt worked very closely with the Schwarzenegger administration and really showed the state government what a value telemedicine has. So outside of improving reimbursement, which is very selfish but also very necessary for providers, I think that the Patient Protection and Affordable Care Act is incredibly telemedicine friendly because it talks about changing how we deliver healthcare. That's really the essence of telemedicine. Telemedicine is about changing how patients experience healthcare and how you can deliver healthcare. And we also increase access to care and we reduce the per capita cost of care. I think those are the three fundamental principles of the Patient Protection and Affordable Care Act. So we're doing pretty good right now with that piece of legislation.
Perfect. All right. Well, as we wrap things up, let's just tell the listeners here and the viewers of this video where they can find out more about you, and then we'll wrap things up.
Thank you so much. Well, you can always reach us on the web at telemedtoyou.com. Also, all of our general information is there as well. They can email us through our website as well. Again, at telemedtoyou.com is the best way of reaching us, and we'll be happy to provide them with further information. Hopefully, there's some providers out there who are listening to this who'd love to join us. We have a patient recruitment page right there, so we'd love to talk to you about getting involved in telemedicine, and hopefully, there's some hospital directors and CEOs out there who can reach us as well through telemedtoyou.com and talk to us about providing services for their clinics, their hospitals, their skilled nursing care, their urgent centers, etc., urgent care centers, etc.
Beautiful. All right. Well, thank you so much for coming on and sharing your story and talking about your company and telemedicine today. We appreciate it very much.
I really appreciate it, John. It's been an honor and a privilege, and thank you. I really enjoyed watching the videos on your site and really appreciate what you're doing and really look forward to seeing you grow and expand. So congratulations for the great work you're doing.
Thank you, sir. Yeah, thank you. All right, everybody. I hope you enjoyed that conversation on telemedicine and Telemed to you. As always, we'll have a replay of this interview up on the newwavehealthcare.com website. You can go to newwavehealthcare.com/telemed, the number 2 and the letter U.com. That's telemedtoyou.com. We'll have an archive page with a replay of this video and anything else that we've talked about here, links to Dr. Siddiqui and his websites and his profiles and all those things. If you're listening to this on video, you can go to iTunes, of course, and check us out so you can listen to these interviews on the go. Just go to iTunes, search newwavehealthcare.com. We'll pop right up. So go ahead and subscribe and check us out every week. We're pumping out interviews talking about innovation in healthcare and topics in the digital health industry. So hope you all enjoyed that conversation. I'll see you on the next one.